Welcome, everyone, and thank you for joining us for this webinar on exploring NAHDAP, essential tools for finding and using NAHDAP's data and other resources. We are thrilled you can join us today, and now let's begin. Today's presenters are Chelsea Sample Steele, a Senior Data Project Manager, and myself, Raina Lee, a Data Project Assistant for NAHDAP. If you have applied for restricted data before, or if you've ever had any questions about the application process, it is quite likely that we've spoken before. On the other hand, if you plan to apply for restricted data, it is likely we'll speak in the future. For today's agenda, we will discuss and learn about NAHDAP and what it is. We will uncover the types of data you can find within the archive and learn about the resources available. Additionally, we will walk you through a search for data on the NAHDAP website and do a quick review on how to access public data. Lastly, we will review the requirements for accessing restricted data and learn how to do so safely and securely. And now a short overview of NAHDAP. So what is NAHDAP? NAHDAP stands for the National Addiction and HIV Data Archive Program. We are a topical archive or data repository within the Inter-University Consortium of Political and Social Research, or ICPSR, at the University of Michigan. ICPSR is an international consortium of more than 750 academic institutions and research organizations, which provides leadership and training in data access, curation, and methods of analysis for the social science research communities. ICPSR hosts a social science data archive, which consists of over 20 specialized collections, one of which is NAHDAP, our substance use, addiction, and HIV data archive. Other ICPSR collections focus on other topics such as education, aging, demography, criminal justice, and others. ICPSR's topical archives like NAHDAP share staff and infrastructure with ICPSR, so you may hear them talked about interchangeably. NAHDAP has been funded by a contract with the National Institute of Drug Abuse, or NIDA, since the fall of 2009. NAHDAP archives data related to drug and alcohol use, tobacco use, and HIV topics. We offer a variety of services to both data users and researchers who are sharing data or preparing data for archiving, including access to restricted and public use data, data preparation, support letter for grant applications, user support, training, and educational resources. We will get into more detail about these services shortly. NAHDAP's mission is to facilitate research on drug addiction and HIV infection by acquiring, enhancing, preserving, and sharing data. We work to make data findable, accessible, interoperable, and reusable in the substance use, addiction, and HIV research communities. Our team consists of a project director, Dr. Amy Pienta, data project managers, and data project assistants. Other ICPSR staff who support our NAHDAP work include ICPSR's curation team, privacy and security team, community computing and networking services team, metadata team, and others who are the driving force behind this repository. In addition, NAHDAP is heavily supported and receives guidance from our federal project officers at NIDA, Janet Kuramoto Crawford and Heather Kimmel. NIDA provides guidance on NAHDAP's activities and the future direction of the archive. As we briefly mentioned, some of the services NAHDAP offers are support for data deposits, data access, data curation, measuring data use and impact, outreach, training, and user support. Today, we will highlight data access, including restricted use data, outreach, training, and user support. If you have yet to visit the website, here we have provided a link to the NAHDAP website, as well as a snapshot of what it looks like. You can also see here the number of resources available through NAHDAP. At the time of the screenshot earlier this month, we had 613 studies, which may include many data files. We also have over 1.2 million variables and over 29,000 publications linked to the studies we disseminate. And with that being said, I will turn over to our presenter, Chelsea.
Great, thank you, Raina. In the next section of this presentation, I'm going to go over some of the data and resources that NAHDAP has available. First, as Raina just shared in the last slide, NAHDAP has a lot of data. So we currently make data available from over 600 studies. And as Raina mentioned, a study is a collection of data, and each study may include one or many data sets. Of the studies that you'll find on the NAHDAP site, the most common subject terms that are tagged are drug use, demographic characteristics, tobacco use, alcohol, and youths. The NAHDAP collection includes NIDA-funded studies, but also studies funded by other organizations and institutes, studies including substance use components of all varieties, studies on HIV-related topics, epidemiological and observational studies, studies including biomarker data, studies focused on prevention, and data from all ages and across the lifespan. NAHDAP accepts and disseminates data of various types and formats, including quantitative, qualitative, geospatial, imaging, and video data. The NAHDAP collection is very broad. NAHDAP has data that are both public use and restricted use. Public use data generally contain no identifiers and pose a minimal disclosure risk. They are immediately downloadable from the NAHDAP website as long as you authenticate with ICPSR and agree to the ICPSR terms of use. Restricted use data generally contain indirect identifiers, which can pose a disclosure risk. In the case of these data, the documentation files, such as codebooks and user guides, if available, will be immediately downloadable, but you will need to apply for access to the restricted use data files. This will involve gaining IRB approval or exemption for the proposed research project, signing a restricted data use agreement, and other requirements. In most cases, data are free to use. There are some exceptions for restricted use data, but these are in the minority of cases. To elaborate on this a little bit, there is generally no cost to access data that NAHDAP manages because we are sponsored by NIDA, a federal agency. However, on our website, we also cross-list topically relevant data that are owned by other archives within ICPSR, and in some cases, some of those studies may have fees associated with them. For restricted use data, there are occasionally fees to access our virtual data enclave, where some of our restricted data are made available, but that's only the case in a couple of the studies that we maintain out of hundreds, so it's very rare. The studies that I've listed here are just a small selection of some of our most popular data collections and series. First, the Population Assessment of Tobacco and Health, or PATH study, is an ongoing longitudinal cohort study on tobacco use behavior, attitudes and beliefs, and tobacco-related health outcomes. The study sampled over 150,000 mailing addresses across the United States to create a national sample of those who do and do not use tobacco. Monitoring the Future, or MTF, is an ongoing study of the behaviors, attitudes, and values of Americans from adolescence through adulthood. Each year, more than 25,000 8th, 10th, and 12th grade students are surveyed as part of the MTF main study, and approximately 20,000 adults aged 19 to 65 are surveyed as part of the MTF panel study. The Monitoring the Future panel study conducts annual follow-up surveys with a subsample of each graduating class, who complete a follow-up every 2 years from ages 19 to 30 and every 5 years from age 35 onward. The Pathways to Desistance series is a multi-site longitudinal study of serious adolescent offenders as they transition from adolescence into early adulthood. And finally, the National Wellbeing Survey is an annual population-based cross-sectional survey of adults aged 18 to 64 in the United States, first collected in 2021. Survey topics include psychosocial well-being, social relationships and support, participation in social activities, physical health, mental health, health behaviors, healthcare use, employment quality and experiences, COVID-19 experiences, socioeconomic measures, political orientation, and demographic measures. ICPSR's bibliography of data-related literature is another great resource that is available for all NAHDAP studies. The bibliography is a collection of references for publications that have used ICPSR data. ICPSR's bibliography team searches databases for mentions of the data collections we maintain to find publications and other resources that demonstrate the authors have used a given data collection, as opposed to just mentioning the data collection in the paper. Each study that we maintain will have a bibliography of these references. So as you can see, this tool would allow you to gain a better understanding of a given data collection would allow you to see what work has already been done with the data before you decide whether or not to access it, and also demonstrates the impact of a given data collection. NAHDAP also provides education and training resources for data users, including summer workshops in ICPSR's annual summer program, webinars and presentations on NAHDAP services and data collections, data-driven learning guides, and links to external learning resources. Each summer, NAHDAP holds workshops on using two of our most popular data collections, the PATH study and Monitoring the Future. Materials from past workshops and webinars and other learning materials are linked on our training and support page on our website. In addition to our data and learning resources, NAHDAP provides user support to data users in the form of email and phone support, as well as online FAQs, webinars like this one, and training videos. Common topics include help finding data, specific questions about a particular data collection, and help applying for restricted use data. We also provide support for people wishing to share their data with NAHDAP, including consultation during proposal preparation, reviewing data management and sharing plans, supporting data governance and agreements, technical assistance calls to plan your future deposit, and data review and guidance during the data preparation phase. So now that we've talked about the types of data and resources that NAHDAP provides, I would like to walk you through using the search tools available on the NAHDAP website to help you find the data and resources that you're looking for. The first thing I want to show is how to start by using the search bar on the NAHDAP website. It's very basic, but this is usually where I go to start a search on the NAHDAP website. So if you click the magnifying glass that I've highlighted here, just on the search bar with no key terms entered, this will actually pull up all search results that are available in the NAHDAP site. So you could look at everything available through NAHDAP by just doing that. That's an easy place to start. On every subsequent page of the NAHDAP website, besides the homepage, there will also be a similar smaller search bar in the top right corner, which you can use in the same way. You can just click go and it will bring you to all search results for all data on the NAHDAP site. Another option for finding resources, so data, variables, publications, and other things on our site is to go to the Find Data tab. And if we're looking for data, I would select the data option, which is right at the top of that list. Doing that will bring you to this page, this Find Data page, which again has a search bar where you can just click go to find all of our resources, or you can start entering some search terms. You can see some search tips on the right-hand side here that tell you how you should go about doing your search, using quotations, searching for multiple keywords at once, and how our search works with some standard typical search functions that you see on other sites. On this page, you'll also see some options for browsing data, so you can browse only more recent data collections, studies for which there's an online analysis component available in case you wanted to do some basic review of summary tables. All studies funded by NAHDA is an option you can browse by, or a particular subject or series. But you can also just start a search here as well. So that is what I'm going to do in our tutorial. So I decided to search for the phrase tobacco use. And this is going to search for the entire phrase tobacco use in the study and variable metadata fields, including the study description, variable labels, value labels, question text, and other fields that are available in the metadata, not just the study title. So it should find relevant resources for you using all of the fields and not just something basic like the study title. The first thing I did on the search results page is to expand this search tips box here so that I could show you what some of the search tips are for using search on our site. So as I just mentioned, the search terms will compare against any metadata fields in that study. Because our holdings are large, we recommend using multiple query terms if you can. So tobacco use was a pretty effective result, more so than using tobacco, but you can see we still have a lot of results, so we may even want to pare that down further. One other thing that I like is the the minus option. So if toward the bottom here, it says you can exclude results by using a minus sign. So if you wanted to look at tobacco use, but you don't want the results to be tobacco use in adults for some reason, you could try out that kind of a search option as well. Okay, so those are our search tips. Take a look at those when you work on your search. And so after we look at those, so one question that comes up sometimes is how to deal with terms that also have a shortened version. So for the example that I want to share is the example of the phrase opioid use disorder. It also has a shortened version of OUD. And I tested that out for this presentation, and I found more results using the full phrase opioid use disorder. But I would recommend trying to search both ways to see what provides more relevant results for you, because although OUD had fewer results, maybe it's a case where those results might be more relevant for you. So it's all going to come down, what your results are going to show is, so in this particular example, what that's showing me is that more of our studies in the metadata fields are referring to the phrase opioid use disorder than shortening that down to OUD. And so in this particular case, that works better. But again, I would recommend trying it both ways. Okay. A couple other things on the search results page that I want to share is that there are different tabs that you will see with results. So I searched for tobacco use, and I can see these different tabs here. So studies, which is the one highlighted, data-related publications, variables, series, and the NAHDAP website. Studies is the tab that you want to use to look at actual data sets or data collections for your search. Data-related publications is going to show the results for those search terms in the ICPSR bibliography, which we discussed. But note that in the case of the ICPSR bibliography search results, the search phrase that you are using is going to pull results up that typically are included in like a reference or a citation, because we usually don't provide full text for our publications on our site unless they are freely publicly available resources. So many peer-reviewed journal articles, for example, are copyrighted, and so we would not have the full text for that on our site. So your search term is not necessarily going to be searching the full text of those resources. And the reason I like to mention that is just to encourage you to think strategically about what phrasing might occur in like an article title, for example, might be different than what phrasing might occur in a full text of a particular journal article. So keep that in mind. Similarly, the variables tab, this includes a listing of variables that are included in the NAHDAP studies, if those variables have been indexed on our website. And so a search result there was going to show that term in the variable level metadata. And then the series tab includes the series, or which in our terms, a series is a set of studies which are most relevant to our search terms. So an example of a series is, so I mentioned monitoring the future earlier. There are individual studies. For example, there's different studies for the panel data, different studies for the annual 8th and 10th grade and 12th grade data that are collected. And those are all tied together under one series umbrella. So there's a monitoring the future series as well. So the series results are going to show results for that. The NAHDAP website will just show pages on the NAHDAP website that match those search terms. So like typical website pages about, help, frequently asked questions, other help pages and resources on our site. Okay, so for our terms tobacco use, we have over 300 results. There are some things that you could try to do to narrow or sort your search down without further adjusting your subject terms yet. So one of these is the sort by function that you'll see on the website. By default, the results are going to be sorted by study relevance, which means that these are the studies that had the most information in the metadata matching the search terms that you used. However, I usually like to try to use the released and updated sort function, because that's going to show me the most recent releases. And a lot of times people are looking for more recent data. I also like the most cited in the ICPSR bibliography option because that will show studies that have high usage or high impact. However, just note that studies being released more recently just by default are not going to have as many citations in the ICPSR bibliography because it's going to take time for people to publish on those data and to build up that reference pool for that study. Another option is to use the filters on the left-hand side to narrow through these results a little bit further. So the subject terms filter is a great one if you wanted to, you have your results for tobacco use, maybe you wanted to search for a study that has additional subjects, related to your search. Maybe you're interested in like youths or something like that. You could filter and pare those results down with the subject terms filter. The restriction type filter is really useful if you know that you need public access data because you don't have the option to apply for restricted access data. Maybe you need them very quickly for a class project or something like that. So you can search only for public access data using that restriction type category. The data format filter is useful if you are looking for a study that has a particular statistical package format available, so SPSS, SAS, or Stata, or others. The majority of our data are going to have all of those, but some older studies might not have those, so that could be helpful for you to help pare down if you just know you can't use data that doesn't have one of those available. And then time period is a really useful one. So for example, maybe you're only interested in data of tobacco use in the 1990s. You could use that filter to try to pare that down as well. One last thing we can do, which I find pretty helpful, is to click the toggle summaries button at the top of the page, right under the studies tab. And this will pull up on your search results page the beginning of the summary for each study. So if you just want to like take a look at your most relevant results and make a quick decision, like that seems interesting, that doesn't seem useful, having the summaries all on the same search results page is nice because you don't have to keep opening each search result and taking a look. So that's something that is helpful sometimes as well. Okay, so next I want to show you the variable search on the NAHDAP website. In this example, I started a brand new search. I just searched for tobacco, and then I clicked on the variables tab on the search results page. And the search results are showing me all relevant variables that are part of studies that NAHDAP makes available, which have their variables indexed on our website. A lot of our variables are indexed on the site. We currently have over 1 million variables indexed, but not every study that we release does, which just means you wouldn't be able to search variables from some studies on our site. You would have to actually like download a codebook file to look at those variables. But many of our studies do, and so this can be a good way to start weeding out or finding particular studies that seem to crop up regularly when you use the variable search to look into further. Very similarly to the bibliography search, when using the variable search, you should use search terms that you think are likely to appear in a variable name, a variable or value label, or question text, because that is what this is searching. It's searching on keywords with those variable level metadata fields. So for example, it's a lot less likely that a variable name is going to have the phrase tobacco use in adolescence than it would just have the word tobacco. So think strategically like that when using the variable search as well. You can see in the search results here, this example variable down here, that the results show the variable name, label, and question text, variable type, and the study and data set that variable is from. So that's sort of where you can see, okay, I found this variable, it looks really useful. It's taken from the National Youth Survey data set 1. Maybe I need to go in and take a look at that study or that codebook for that study and that data set to see what else is there. And maybe this will be useful for my project. So in this case, I chose one of the variables in my search results to show you what you will see when you click on one of the results pages. So in this example, you can see at the top, the study that the variable came from, the series that the variable came from as well, the variable's name and label. In this case, the question text is available. Question text is not always available for every variable, but in this case it is. So we can see the actual question asked here. the frequencies of responses for this variable, and summary statistics for this variable. So it's really useful for getting a quick idea, like especially if you're looking at like demographic characteristics for a study to see if you want to use it. This would be a good use of that, is like, how many men, women, people of the different racial categories were included in the study? Is this something that fits for my needs? The variable search also allows you to compare variables. So in this image, I've selected two variables, and I'm going to click the compare button at the top to show you what those compare results look like. In this case, you can see it just sort of worked out that two of the results looked like they were the same variable, but from a different way or a different year. And so I just kind of wanted to use that as an example to see what it's going to show in our compare results. So the results show the two compared variables, one on top of the other, including the same information found on the variable results page we saw before, as well as some additional metadata information, such as the time period and the universe of these data. So there are several reasons why the variable search might be helpful, as you can tell. So for example, it can help you to find data or determine whether a data collection will work for your project. For example, as I mentioned, by viewing frequencies of particular variables, such as demographic characteristics for participants. It can allow you to compare waves from within a series. It can allow you to compare studies of similar topics to determine which will work best for your project. And also could be used to help you develop measures by seeing what questions and measures others have used to study specific concepts. Okay, the third search option that I want to share is the bibliography search. You can navigate to the search by using the Find Data Publications option. Like at the very beginning, we saw at the top of the NAHDAP page, there's a Find Data button. You can go to the Publications page. The other way to do it is just to do what we've been doing and search in our search bar and then click the Publications tab. So as I mentioned, the bibliography is a collection of publications as well as unpublished resources, such as conference presentations or white papers that have used the data that we have in our NAHDAP collections or ICPSR collections. When our staff find an article or other resource that mentions one of our data sets or studies, they enter it into the bibliography and they link it to the specific study that the authors used. So when you search the bibliography, your search terms will be compared against the citation information from the sources within the bibliography. As I mentioned, it's not necessarily going to search against full text, as that's usually not captured, especially for copyrighted materials. So, when you're picking your search terms, as I mentioned, it's important that you think about what terms will typically show up in a resource title, a journal or a publication name, or author names. I used my same search term tobacco here, and we got a lot of results. And I also did want to mention that the number of results that are going to appear, especially when you see how many are tied to a particular study, it doesn't necessarily reflect how many resources out there in the world that have used the data. It's just the ones that our team has found. So we search for these regularly, but there may be additional ones out there. So of course, a sidebar, if you find any, or if you have any publications that have used a particular data set and you don't see them in the bibliography, we would love to have them. So please send them to us. Okay, as you can see here in the results example, the results show the publication type, publication year, reference information, link to the full text if it's available, or link to the place where the full text could be accessed, and a link to the data collections that the authors used. So the example here was linked to only one NAHDAP study, but each reference could be linked to many different studies. So some of them have a whole list of studies linked there. We can filter our results as we did our data or variable results. So for example, we can filter by publication year if we want more recent results, for example, publication type if we're only looking for peer-reviewed articles, and a few other options here. So that was a brief summary of our search capabilities. I just want to leave you with a few summary reminders to guide your search in the future. So remember that in the data search, the search terms you enter will search against the study's metadata field, not the data files themselves. As we discussed, the variable search will be most effective if you search for terms that are likely to be found in variable names, labels, or question text. And finally, in most cases, the publication search will search the citation as opposed to full text, since full text is usually not available on the NAHDAP site due to copyright concerns. And that's that for the search tutorial. I'm going to go ahead and hand the presentation back to Raina to go over some information on accessing NAHDAP data.
Thank you, Chelsea. We will now cover in more detail how one may access the data we provide here at NAHDAP, as well as some of the main requirements for doing so safely and securely. As you may have noticed, NAHDAP provides both public and restricted data. Public use data is available by downloading any of the provided formats of the data directly to your secure computer device. By creating a free account and agreeing to ICPSR's terms of use, access to the public data will be granted. Restricted use data, on the other hand, will generally contain sensitive information and can pose a disclosure risk, are only available by completing an application successfully. Some studies may include both public and restricted data. If the restricted data is also desired, an application is required for access to the data. NAHDAP offers access to the restricted data in multiple ways, including a physical data enclave, which is located here in Ann Arbor, Michigan. As mentioned before, a public use data is readily available by selecting the download option and by choosing any of the desired formats. Please note, you must have created a login and agreed to the terms of use in order to readily download the data files. On this slide, we have an example of a publicly available dataset that can be obtained by simply clicking the desired data format and downloading the file. Now, restricted use data may again only be accessed through the process of submitting an application successfully. A secure download is a method in which the researcher will be provided instructions and a password-protected temporary URL that contains the encrypted files. These may be downloaded and moved to a secure location that abides by the specifications mentioned in the data security plan of the approved application. Alternatively, NAHDAP provides data via the Virtual Data Enclave, or VDE. Instead of receiving a downloadable copy of the data, researchers are approved to access the data stored on ICPSR servers via a remote desktop connection. Researchers are unable to move files from the remote desktop to their own desktop or to the internet. Approved users with access to the data may only work on the provided files via the VDE workspace. Users may not copy, email, or otherwise move files outside the secure environment. However, to receive output from the VDE, researchers may request that ICPSR conduct a disclosure review of the desired files to be removed. Due to the restrictions of the VDE's secure environment, you may not have access to your typical software. However, you can find an array of packages within the VDE. For example, you may find R, SPSS, or Stata for your project's needs, and many more useful packages. NAHDAP also provides the option to access restricted data via a physical data enclave, which is located on-site at our offices in Ann Arbor, Michigan. Data in the physical data enclave are typically those with highly sensitive information or with a high risk of harm if re-identification were to occur. Researchers approved to access the data in the physical data enclave must travel to our offices to access the data on site. Similarly to the VDE, researchers must have all output reviewed and approved by ICPSR staff prior to the removal from the secure environment. Here we have an example of a study homepage on the NAHDAP website. There are two places you can look to determine that the study includes restricted data. One is by identifying the Access Restricted Data button toward the top of the study. And you can see by this arrow here pointing to the button. And the second is by noticing the red highlighted text in the lower right-hand box that says, one or more files in this data collection have special restrictions. Select the Access Restricted Data button and review the requirements of the pop-up prompt to determine the next steps for applying for access to the data. Here we see a pop-up prompt that provides some information about the requirements for access. This is an example of a study available via a secure download. You can see the list of application requirements as well, and the continue button at the bottom right, which will navigate you directly to the online application. This is another pop-up that you may encounter when selecting the tab to begin the application process. This example is of a study available in the Virtual Data Enclave. A link to the VDE guide is also provided for detailed information on how to navigate the VDE. Similarly, the Start Application button is on the bottom right and will take you directly to the online application. The following are application requirements for restricted data available via a secure download. The list includes some basic information requirements, such as the name of the primary investigator, which is typically a lead researcher with a terminal degree, a description of the proposed research that supports the need for access to the restricted use data, the name and email addresses of all the individuals who will have direct access to the data, as well as the make and model of their computer device. A selection of the desired data format is also required, a confidential data security plan describing in detail the specifics of how the data will be handled, an IRB approval or exemption letter, and an RDUA signed by both the primary investigator and the institutional representative. And lastly, the confidentiality pledges that must be signed by all of the associated staff that will access the data. Restricted data available in the VDE have similar application requirements with some minor differences. The confidentiality data security plan is incorporated within the restricted data use agreement, and researchers must adhere to the requirements set forth by NAHDAP therein. NAHDAP will require a CV or an NIH biosketch for each researcher or staff who will access the restricted data. Additionally, all team members will agree to a confidentiality pledge each time they log in to the VDE. There are security requirements that must be met before acquiring the data through secure dissemination. For example, special computer configurations must be set, and the location of the device must be as such that no one except for the approved research staff can access the data. Malware and virus protection should be installed on the device and kept up to date to prevent compromising the restricted data. Protections against loss and theft should be implemented. Moreover, output must be reviewed for disclosure risk by NAHDAP staff and to ensure that any merging of restricted use files is done appropriately. Backup of restricted use files and other project files is not permitted. Other files such as syntax should be encrypted and securely stored. Lastly, adherence to security protocols such as completing annual reports, ensuring all research staff follow security protocols, and the renewing or terminating of the data use agreement when the data is no longer needed. When the data is no longer needed, the user should complete the end of the project requirements, such as destroying all restricted use files and submitting a notarized affidavit attesting that this was done. In addition to the standard security requirements described in the previous slide, the Virtual Data Enclave has additional security requirements, including physical security requirements, IT security requirements, and restrictions on information sharing. Regarding physical security, the computer from which the approved users access the VDE must be located in a secure office in which the monitor is not visible from a doorway or any windows. The office door is closed, and when the VDE is in use, and only the approved VDE users are in the office when the VDE is in use. Additional IT security requirements include password protecting the computer, having a screensaver during the periods of inactivity, and restrictions on VDE login and password sharing. Finally, VDE users are restricted from sharing information from within the VDE unless and until it has been reviewed and approved by NAHDAP staff. This means users are unable to take written notes, screenshots, or type any direct information from the VDE onto their own machine, device, or notebook. Doing so would constitute a violation to their restricted data use agreement. Now we will review the most commonly asked questions we see. The first question being, can we request more data? We get this question quite often, and I believe in the chat we did see, I believe we saw a question related. Users may request additional data even if there's data that is newly released, as long as the requested data is relevant to the research aims and objectives and a justification for the additional data is provided. Another question we typically see is, are we able to collaborate with colleagues from different institutions? Collaboration amongst colleagues is allowed. However, since the RDUA is an agreement between a particular institution and ICPSR, an individual from another institution must provide an RDUA from their respective institution. Another question we see is if we can answer statistical questions. Statistical or analytical questions are best reserved for your project's lead investigator or the investigators who collected the data series that you are particularly interested in. In the website, you would typically see a citation and more information about the specific individuals listed, as well as links to the website from the data series. Another question that we most see is, how long does it take to review my application? And when will I have access to the data I requested? This typically takes about 2 to 3 weeks. However, if any modifications to the restricted data use agreement or other application changes are made, one can expect the process to take anywhere between 2 to 3 months. Therefore, it is not typically recommended. Now, to end things, we will provide resources for you on the next slide, such as educational and training materials here that are found on the NAHDAP website, information about applying to access NAHDAP restricted files and data, information about the terms of use required for public use data, and information on sharing data with NAHDAP. Thank you all again for joining us for this webinar today. To learn more about NAHDAP, you can visit the website listed on this slide. You can also contact us by sending an email to nahdap@icpsr.umich.edu. Now we are happy to answer your questions.
Thank you, Raina. We have a few questions that have come in the Q&A, some of which I've already answered, a couple of which have just come in, so I'm going to answer them live. So one of the newer questions is, what is your data retention policy? And we, in general, we retain data in perpetuity. So we do not, once we receive and release data, it is permanently archived with us. And the goal is to have it permanently available as well, unless something came up that there was a reason that we had to take it down. So for example, inaccuracies in the data or some other reason that might have come up. So that's a great question. And the other question that just came in was, when doing multi-institutional collaborations, do people usually follow an SIRB process for getting IRB approval to use NAHDAP data? I'm not sure if I know what the question is asking, but I can share what the process usually looks like for multi-institutional collaborations. So if you are accessing data that's available in our virtual data enclave, we will allow multi-institutional collaborations with one institution having its own IRB, and that being the main IRB for that project, for that research project. But each institution that is working on that project has to have a separate restricted data use agreement. And the reason for that is that the restricted data use agreement is an agreement between our institution and the data users institution. So we need one for every institution represented. The single IRB. Okay, so so in the case of VDE data, you could have one IRB documentation for the entire project, even if there were multiple institutions collaborating. For secure download data, we do it a little bit different because we're sending you a copy of the data, and the data actually resides at each institution as opposed to residing with us. We would require each institution who is collaborating on that project to each provide IRB documentation. I hope that that answers that question. Please feel free to send a follow-up if you'd like more information about that. And then I want to just share some of the, oh, there's another open one. Oh, never mind. We answered that. Okay, so I wanted to share a couple of the ones that were answered. There was a question about an email to sign up to receive news about new data releases. NAHDAP tries to share our releases on our website and our social media, but there is a fail-proof way of getting updates for any ICPSR or NAHDAP data collection that's released. There's a listserv that you can sign up for. I believe it goes out weekly. I could be wrong about that, but it's frequent, and it will just have a list of any new data collection that has been released. And so I added a link there to the Q&A box. And then we had a question about, like, when you're applying for restricted data, does each institution only have one restricted data use agreement that would cover anybody accessing data at that institution? And unfortunately, no, the restricted data use agreement is per research project. So there could, we have many institutions that we work with that have many restricted data use agreements for different researchers at that institution working on our data. Okay, there was a question about what is an example of the type of data that would be stored in the physical data enclave versus data not in the physical data enclave. And in that physical data enclave is really reserved for data that are either the most highly potentially identifiable or the most sensitive sensitive in that way, or sensitive in the case of the risk of harm for participants in that data collection is high if there was an identification. So I provided a couple of examples of data that ICPSR has in that physical enclave. And then a great question about being able to view variables before you, request access to the restricted data. And yes, you can, even if the variables, so in the variable search tutorial, I showed that some studies don't have the variable metadata indexed on our website. You can still view all of the variables in a restricted data set by going to the study homepage for that data, for that study, and looking at the codebook files that are found there, and you can see all variables in that study. And you can download those without an application. The documentation files are publicly available, so you can get those and help determine if you need access to that data collection or not ahead of time. Okay, I'm not seeing any further questions right now. We will follow up. We'll follow up afterward with the slides, and please feel free when you get that email from us to respond to us if you have any more questions, or you can email us here at the email address that you see on the slide. We're happy to work with any questions that you have. We're so happy that you were here today, and we want to thank you for being here, and we will hopefully talk to some of you soon. Thank you, everyone.